remember seeing Michael last year, a 67-year-old retiree who came into my office exhausted and frustrated. He told me, "Every day feels like a roller coaster. Breakfast sends me soaring, mid-morning crashes hit me like a ton of bricks, lunch is a spike, and dinner just repeats the cycle." He was describing something I see all too often: blood sugar spikes that end in dizzying crashes, leaving people drained, anxious, and desperate. His endocrinologist had him on a prescription that promised to help, but it left him bloated, gassy, and running to the bathroom multiple times a day. He was paying hundreds of dollars each month for misery. I asked him one simple question that no doctor had ever asked before. "Do you use cinnamon?" He looked at me blankly. I explained that there's a type of cinnamon, not the generic stuff most people buy, that can stabilize post-meal blood sugar spikes in as little as a week. It's called Ceylon cinnamon, sometimes labeled as true cinnamon, and it's completely different from the common cassia cinnamon you find in most grocery stores. Cassia contains a compound called coumarin that in high doses can slowly damage your liver. Ceylon cinnamon, on the other hand, is safe to use every day, and studies have shown it can reduce post-meal blood sugar spikes by up to 29%. I guided Michael on how to use it. 1 teaspoon with every meal. Sprinkle it on oatmeal at breakfast, stir it into your coffee, mix it into lunch or dinner dishes. Consistency is key. Within the first few days, his blood sugar spikes weren't as dramatic, and the crashes that used to leave him shaky and exhausted disappeared. By the end of the first week, his glucose readings were remarkably stable. For the first time in months, he felt normal. His fasting blood sugar had started to drop, and he had energy again without the terrible side effects of medication. What makes this work is fascinating. The compounds in Ceylon cinnamon, especially cinnamaldehyde, make your cells more responsive to insulin, so your body handles glucose more efficiently. It also slows the absorption of carbohydrates just enough to prevent the dramatic spikes and crashes that cause reactive hypoglycemia. Unlike medications like acarbose, which can slow digestion but often leave patients bloated and miserable, cinnamon works naturally, gently, and safely. Michael was amazed. "I can't believe something this simple could change everything," he said. "No more roller coaster, no more gastrointestinal misery, no more $300 prescriptions each month. Just a kitchen spice he'd ignored for decades." Over the next month, his blood sugar readings continued to improve. By 3 months, his HbA1c had dropped significantly, approaching a healthy range. His energy was back, his cravings were under control, and he felt like himself again. So if you're struggling with blood sugar swings, check your spice cabinet. If your cinnamon is just labeled cinnamon and costs a couple of dollars, it's probably cassia. Look for Ceylon or true cinnamon and start incorporating 1 teaspoon with each meal. Within a week, you could see a noticeable difference in your blood sugar stability without side effects or huge expenses. Sometimes the simplest solutions are hiding right under our noses, and in this case, on our spice racks.